presentation. It is on coping, how to cope with worries during the corona outbreak. Can I see the slides, please? Rajeshji, I cannot see the slides. Yes, thank you very much. So now, during this corona outbreak, we are actually facing a lot of problems, especially there is a question of survival now. And on top of it, there is lockdown and then social distancing, which we had not faced earlier. So these things, over the period of time, they will be putting up stress, building up stress in our mind. Stress means some kind of tension, anxiety, something like that. So now, what data we have found so far, that this problem will be a long-lasting one. It is not going to go that fast as we did earlier. So we might have to live with the corona just like we live with the rhinovirus so far. So that's why, for the time being, till we have this vaccine, there will be repeated lockdowns in the hotspots, and there could be social distancing we might have to maintain for a long period of time. That means we might not be able to visit our friends, might not be able to go to some gatherings or attend some festivals. So these kind of problems will be there, and that will build up some kind of a worry or tension in our mind. So how to cope with that stress, we'll be discussing in the few more minutes with that. Now, coming to the most important thing about the stress, it is basically a reaction which we perceive to some kind of demands and threats. That means what is stress for me might not be a stress for yours. It's an individual perception, and it's mostly relative. And as we get into the deeper and deeper of the stress, we'll be finding that many of the times it is actually artificially created. It is not actually existing there. Now, when we stress out, it is basically like we perceive a situation to be very dangerous or difficult or painful, and we do not have a resource to cope with the stress. That is the time we feel very stressed out. Now, some kind of stress is actually beneficial for us. If there is no stress, what happens is we do not have the urge to do anything, and that is the problem, that people won't work, right? So the productivity will go down. So that's why we need to have some kind of a stress to move us forward. That is called eustress. That is actually helpful to propel us in future. But the other point is, when this kind of stress becomes more and it becomes unbearable, and it is we are oppressed, that time it becomes distress. There is a very thin line between eustress and distress. It depends on person to person. So if we practice certain mental relaxation techniques or meditation, then we might cope with the stress better. What we perceive as stress might not be that much felt later. So there are certain causes of stress, which are situations that have strong demand, situations that are intermittent, imminent, life-threatening conditions, then maybe some kind of a deviation from the norm, which can cause stress. And there are different levels of stress, different types of stress, and these are actually mental blocks which build up in our mind from time to time. Stressor is actually an event or an experience or an environmental stimulus that builds up the stress within ourselves. So these kind of stressors we need to identify in life and then try to overcome them. Now, different kind of stressors are like crisis, catastrophe, then major life events. The micro stressors are our daily problems which we face, and there could be some ambient stressors which we receive from the environment, pollution, overcrowding, or the traffic. These kind of things also can cause stress. So every day we are subjected to some kind of stress or the other, and many times we overcome them, but sometimes when we are unable to overcome, it becomes distress. Now coming to stress management, this is where which is very important for us. Now during this COVID time, most of the time uh, we are thinking that this is a torture and we are in prison, we are unable to do anything. But we have to look at the positive side of it. What are the advantage we can do? We are going to discuss those advantage things, because this kind of opportunity, suppose we survive, then we perceive this as an opportunity where we can do many things for ourselves. Now, stress management techniques are avoid unnecessary stress, alter the situation or adapt the stressor, accept the things as we are unable to change. This is very important thing. And then relaxation and try to adapt a healthy lifestyle. So once we accept the reality, we are actually out of the stress, but many times we fail to do so. Then the first thing is, whenever we are stressed up, we need to look for a support system, maybe in the family or in the friend circle. So we need to look out to someone with whom we can share our feelings and share our problems, and who will be sympathetic or empathetic to our things, and will be giving us some kind of a solution or show us the way how to resolve the stress. Now, another thing which we have to be good listener before we give our views to others. So this is one thing which we have to do on our own. So most of the time we put on our views on others without giving the other person a chance to say what they want to say. So become a good listener. Don't give your views unless it is really asked for. So this is a very important message. At home you can manage the conflict with this. Then we should be non-judgmental or impartial. That means try not to impose your own ideas on someone else, especially when you are at home, when the subordinates are there, maybe wife or children. Don't put your ideas. Every person is unique. They have give them a chance to think and do the things on their way. If there is a problem, then you help. Then the other thing is, most of the time we compare. So this is the problem. At individual level, better not compare. When we take a decision at public level, then we need to compare. That is our research work. But at individual level, better not compare yourself with anyone. Now, the next thing is, do not rationalize, because most of the time what happens when we get a problem, instead of solving the problem, we try comparing our problem with the other. We say that my problem is more problematic than yours, and we try to say that I cannot solve it. It's impossible to solve. This kind of statement comes, and then we are in the negative side of it. We cannot solve the problems if we are thinking negative. Now, life is actually 10% which is having a problem, and 90% is how we react to it. Most of the time, these problems are artificially created. Later on, someday when we talk about the spirituality, you'll be understanding that as we go deeper and deeper into a problem, we find that the problem actually doesn't exist. And how it is, it takes a lot of time to understand. So it's easy to say like that. Now, whenever we get a problem, instead of complaining, you try to look for solutions, and that is the most important thing to do. As we look for solutions, if we get some solutions, see whichever is the better one to implement, and try to implement that one, you're out of the problem. So this is a very important thing. Don't complain about the problems. Always try to look for solutions. Think like the nature has given you this problem, and maybe you are the best person to solve it. That's why you got the problem. So try to work it out the best way you can, how you can solve it. So this is a very important positive frame of mind. So like just now I was telling you, like when we are we're restricted at home, what are the best way we can utilize our time to propel our career, to enjoy ourselves? That is very important thing. Now, every problem is actually empty. If you go deeper and deeper, this is from the philosophical point of view or spirituality point of view also, you'll be analyzing a problem, you go deeper and deeper, you will find that the problem actually doesn't exist. Most of the time, we are actually putting someone else's problem in our brain and getting exhausted in trying to solve that. So this is the thing. So many times the problem might not be mine. Now, the problem solving exercise, this should be the key thing. Every time, every day, every moment, we should try to solve do like PBLs, solving our problems. So that is a very important issue, very important way to tackle these things. Now, set up whenever in life, when you are setting up some goals, make sure it is a practical one. You understand your strength and then set up your goal. Don't try to compare with others and try to set up a high goal which you cannot reach. This setting up a goal is like an eustress. Some goal has to be there in life so that you can do something better. But do not compare other people's goal and get stressed up. Now be realistic and monitor your pace and know your limits. This is very important. So slow down, don't rush. This is the most important message now. Do not rush with anything. Always slow down your pace. Do things at your own pace. Other people might be rushing, might be giving a lot of time frames and all, but you do a work best according to your capability within your time frame. Do not rush against time. And then somewhere down the line you have to say no, because otherwise if you accept every opportunity and every request, you will somewhere down the line you will get burnt up. So always, this is a very important message. Try to say no when you cannot handle it anymore. Do not stretch yourself too much. Then avoid multitasking. Always try to do one problem at a time, try to tackle one problem at a time and solve it efficiently before going for the second one. You need to put quality to solve each problem. If you do multitasking many times, the quality is compromised. So do not do multitasking unless you are in that, unless it's an emergency. Then plan yourself, take time, put a schedule and set up your priorities. That is, organize yourself. So if you can organize yourself, then everything will go fine. So this is the time when you can organize yourself. As we are staying at home, there is not much of office work going on, not much of teaching work going on. So this is the time you organize yourself, reset your system, set the reset button and put everything back in place, which you should be doing. Then always take care of yourself, because you are the most important person. Most of the time we do not take care of ourselves. We are actually trying to help others and we get stressed up in that. So social work is something like, unless we are happy, we cannot make other people happy. So first make yourself happy, relax, and then you try to help others. Now, rejuvenation and relaxation is the most important part. Take short breaks during your work, and then you can take power naps. These are actually rejuvenating your life. They will actually stretch, relax you at the point of stress. So this is very important. Whenever you are doing some important work, try to work for a while and then take a nap or take a break. Do not work for more than 20 minutes. That's my suggestion. And then always try to see where you have some laughter or humor in your life. Try to add that whenever possible. See some movies or see some cartoons or listen to some reality shows where laughter challenge is there, something like that. So you will feel happy. And then this is the most important message: get back your childhood. Now, this is the time you can get back your childhood, when you are having ample time at home. So whatever things made you happy during your childhood, like your hobbies and recreations and creative things, try to get back in your life again and spend at least 20 minutes on creative activities every day. This is very important thing, especially even when you are working also during the evening time. After you come back home, take a shower, and then you can do that, or before going to bed at night you can spend 20 minutes on that. And then you can play some indoor games with your family members, which should be something like analytical thinking or having some coordination skills, which will help you also uh, to work your brain in a better way, and then relax also. Now the next thing is the exercise. Now at home, you can walk within the house, or if you are going to the terrace, you can walk there, because nowadays we are not going outside. And then the some kind of exercise or yoga. You can do freehand exercise or yoga, but don't bend too much, put too much stress on your back. Just do it as you can bear it. Now relax on the sofa, and or you can enjoy the nature and do yoga or meditation. These are the relaxation techniques you should be doing every day. This you should make it a part of your life from now onwards. It's very important. If you are not relaxing, you are you stress is going to build up, and then you cannot perform better. Neither at office you can perform better, neither at home you can do the household activities. Now the breathing exercise and muscle relaxation techniques, visualization. This is also a very important thing. Wherever you have visited earlier, some places, you just sit on a chair, close your eyes, and try to imagine those happy memories. Get yourself to that, or you can watch the travel channel and try to imagine as if you are in that place. So this way, you are in a virtual world, and that will make you very happy and relaxed. And always remember the happy memories in life. Do not bother about the tough times. Now, this yoga is a very important thing. Just do the freehand exercise or easy type of yoga postures. Do not do any kind of strenuous exercise at this point, because none of the doctors are available now on the OPDs. So you'll be in trouble if you have some this sprain or something. It will be a problem for you. Now, the insight meditation. This is one thing you can do every day, something like a power meditation, where you can do meditation for only a small span of time. You can start with 1 minute and slowly add it up, and then finally reach a target of 20 minutes at a stretch. This meditation should be done twice a day, once in the morning when you start the day, before you start the day, and at night before you go to bed. So if you are doing the meditation at night before you go to bed, you will be getting a very good sleep. And this thing is, there is no hard and fast rule. You start with small span of meditation, maybe with the breathing exercise, or maybe just awareness of your breathing, and then awareness of your body parts. Like that, slowly you can do this meditation thing. Will be some other time we'll be discussing in detail how to do this one, insight meditation. This is like you have to be alert about all the sensory organs and see how your body is reacting to the nature. This is how we become rooted to the present. Now, next thing is, after you meditate, it will be like, say, your mind will open up. So it has to be like a let go kind of a feeling you'll be having it. That is like, don't hold on to ego's ideas or material possessions. Try to get rid of those things, because ego will lead to anger, and that will create problems. So wherever possible, be open mind, do social work that will give you happiness. So many people in this lockdown also, they have gone out to help the others with food and water and shelter, and even the stray dogs also people are feeding. That's a very good gesture, but stay protected before you help them. Now, sharing is very important thing. Always, whenever there is an opportunity, share your ideas or share your material possessions with others, so that try to make people happy. If you share, your mind will open up. Otherwise, you become more and more greedy, and then the problem happens is we don't let anything go. We don't let anything go out of our hands. So that becomes a problem. Now, acknowledge everybody in public, whoever has done some help to you. Whenever you get an opportunity, always acknowledge people in public. This is very important one. So develop this kind of a attitude. You will be actually accepted by everybody, and everybody will love you and help you. This is a very important thing. Now, minimize expectation. This is very important. It takes time to develop this one. Whenever you help somebody, don't expect anything in return. Or whenever you do a job, you do your best, but don't expect that people will appreciate it. That when you get into that level, your stress will be very less. You will be doing jobs as duty, and you will be performing your best to make people happy. Now, practicing minimalism at home is very important. Now, this kind of a practice is started in Japan, and now it is spreading everywhere. It is like, say, you get rid of the other things except those which spark joy in your mind. That means maybe very dear to your heart, essential ones, and the things which are very dear to your heart. Similarly, you can practice minimalism in social circles. Instead of having 1,000 Facebook friends or 2,000 WhatsApp friends, you choose some people with whom you feel very happy and content, and then be in touch with them as often as possible. So that is what is very important. The real friends will be very less, and you try to nurture that happiness among and the friendship. Now, the next thing is avoid self-remorse. So that means you don't hurt anybody knowingly. So that is a very important thing. Don't hurt anybody knowingly, then you won't have this self-remorse. Otherwise, this is the most uh, pathetic feeling in the mind when you have a self-remorse, and you will get into depression. Now, the other important advice nowadays is we do not get proper sleep, right? So try to resolve all the conflicts of the day before you go to bed. If you have hurt somebody knowingly or unknowingly, apologize and finish it off. If somebody has hurt you, just try to forgive and forget that incident. Because many things are not in your hand. You cannot change anybody. Accept the fact that I am in the world not to change anything, not to change anybody. Be like that, then you will be much happier. But you don't try to take any kind of revenge on anybody. Then always perform good deed. Whenever there is an opportunity, try to help people, whether they ask for it or you perceive it. Try to help somebody. That will open up the mind. You will feel uh, doing something better in a day if you are helping somebody. Then some kind of a stress reminders, make gentle reminders to you that always remember the positive side of the problem. When I get a problem, why I have got it, because I might be the best person to solve it. And then keep a gratitude journal. That means always keep a list of the people who have helped you in life. So always try to acknowledge them and try to help them back whenever there is an opportunity. This is very important gesture. So the carry home message is always appraise and avoid comparisons, stay in a positive attitude, watch out for symptoms of distress, and look for coping skills and take help from others if you need, and practice relaxation techniques and meditation whenever possible. So all the time here, right now, many of us are jobless, many of us maybe salaries cut down, or many of us uh, might be in a difficult situation now. So maybe your business is not working well, maybe the we don't know whether later on we'll have money or not. But this is not the time to think of all these things. What we need to think is we have to stay alive. That is the most important message now. We have to fight the virus and stay alive. And if we stay alive, later on, everything will fall in place. We have to just give time. But the need of the day is stay alive, follow the instructions given by the health ministry, stay home, stay safe, maintain the social distance, and stay alive. This is the most important thing. Now, we most of the doctors nowadays we are practicing telemedicine. So if you need any kind of help regarding any kind of health issues, you can always communicate with me, or I can, if some other help you need, I will be connecting to my colleagues from different fields. So, but right now my advice will be don't visit any health center unless it is absolutely necessary, because there will be chance of contamination or getting the virus from outside. So this is the very important thing. And suppose you are calling somebody for blood collection, put a chair outside the door and there you sit and ask the person to collect blood from there for investigation. Don't let any outsider enter your house. This is a very important thing we have to remember. And we're talking about this in our next presentation also. So thank you very much for patient hearing. And if you have any queries, I'll be happy to answer that.
This session is now open for your questions. Thank you. One at a time, others may please mute their microphones and their cameras. This session is open for questions. Dr. Ankur, thanks a lot to have shared
Thank
all
you very
your
much.
wisdom. Thank you so much. We'll be waiting to take on the questions. Maybe we've got internet issues with many of the delegates who've joined here. We'll wait for 2 minutes. If no one is there to with the questions, we can jump into the next session.
Hello.
Hello. Yes, I can hear you.
Uh, Good afternoon, doctor. I'm Padmavati Krishna Kumar, and I'm a medical student from Karnataka.
Yes, good afternoon. Yes, tell me.
Uh, so, I don't know how many students are there in this conference right now, but as a student, what can I do as a medical student in particular? How can I help the community in my capacity?
As a medical student right now, if you are going to help the community, the most important thing is you just see nearby your place if anybody is starving, because many people are on the street without any food. So many NGOs are working with them. So if you can work with them, work with the NGOs, it will become easier rather than putting up individual effort. Or otherwise you see near your place if anybody is needing any kind of help with the food, water, or shelter, something like that, these things you do. But whenever you are going outside, take full precaution as you take inside the hospital. So this is the most important thing. Don't take anything for granted, because we might get the infection from anybody. It has spread in the community. We don't know who is positive, who is not, because the testing is not that it's not covering that much in the population. So better to stay protected when you are going outside.
Okay, thank you so much, doctor. I have another one.
Yes.
I have another question I can ask.
Yes.
How do I help deal with, like, a lot of people, because I'm a medical student, they expect me to know a lot of concerns related to the coronavirus, and they're really worried and anxious. So in my capacity, how can I help them deal with their anxieties or worries about the coronavirus?
Yes, what you do is first you can go through the CDC website and Center for Communicable Disease, and then the WHO websites and our Health Ministry website. You get enough information on the coronavirus, and the latest data also you'll be getting it. So first update yourself, and then what you can do is you can make your presentations on the YouTube and share it in your friend circle, or if they are asking any queries through WhatsApp or Facebook, you can reply them. So these are the things you can do. What I'll suggest is you can develop your own teaching materials on this thing, make it very simple so that any layperson can understand it, and then you put it up on the YouTube so that people can go through it. Or otherwise, if they are asking for any kind of webinar, you can actually participate in that if it is possible. But I doubt that webinars are basically for the doctors, or maybe in the institutional thing. It is not done for the community. The people who need the information, they don't have any kind of access to right information. This is the problem now.
Okay. Dr. Ankur,
Thank you so much, doctor.
Dr. Ankur, this is
Oh,
Dr. Jiva from
hello.
Sri
Yes.
Lanka.
Yes.
Dr. Jiva from Sri Lanka.
Yes. Welcome, sir.
Then now you see there is a problem here as far as the control of corona is happening. UK wanted to have it herd immunity happening, and then they are going to open the universities, and then they are going to open the schools, and then they are going to expose the younger generation to the coronavirus infection, and then to end up in a herd immunity rather than waiting for the vaccine. And then what do you think? Because what about the death rate happens if they are opening so drastically, exposing the children to the what do you call that virus, and then
Yes,
develop.
actually, this is a
That's the
even
original plan
for
of the UK, and I don't know, other countries are not, other countries are hiding from the virus, and they are not
yeah.
exposing them to virus yet. But UK wanted to open out, and then they wanted to develop the herd immunity rather than waiting for the vaccine. Can you explain on this now?
Here, actually, in India, also this kind of thought is going on among certain part of the health ministry people, but there is debate going on there. But if you see herd immunity, we don't know how long will it take. Usually, statistically, anything less than 70% is not statistically significant. So that means we have to expose the community. At least 70% of our community should be exposed, right? This is one important thing. And the next thing is for this kind of virus where the virulence is more, it is spreading fast, infectivity is more. Here you need herd immunity maybe around 80% above. So this much. And it will take time. Herd immunity won't be done so fast. But the problem is that we will be losing around 5% of our population if we are opening up there, because the people who need ventilation, that is 5% of our population who are elderly or having some debilitating disease like chest disease or our heart problems, or maybe chronic smokers, or having diabetes or immunocompromised condition, cancer patients and all. They will be losing them actually. So 5% of the 5 to 10% of our population, if we lose, it is actually not a very smart decision. What I personally feel is intermittent lockdowns in the hotspot areas. Some places you release, and after that, when the cases increase, you lock it down like that. Intermittently, we have to do that, and we maintain social distance for a long time. We don't allow any kind of gathering anywhere.
So,
So
so,
unless this pandemic subsides.
so do you think that
So
we have to live with this virus for another 2 years?
yeah, that is the prediction actually. And what I found is there are various strains of the virus already circulating, more than 32 I have heard. So that means if there is so many strains, we cannot have a vaccine so fast
So
because
why
it is
can't
mutating everywhere.
so why can't we use the plasma? Plasma.
That is like a passive immunity we can try. That is the solution actually. Immunoglobulin, which the people who have recovered from them, if we can get the immunoglobulin, we can use, or even the plasma therapy also might work from the people who have recovered from the disease. But then
No, no,
we
no,
need
no.
to do one thing. We need to do the antibody screening. That antibody screening test has to be stepped up then.
So now this is actually most of the time that when I was reading these articles that they say there's a spike protein that is the one responsible for the virus to go and infect the lung cells, because the lung cells have the receptor for the spike protein to go and bind. And then so
Yes.
you suggest a polyclonal antibody treatment or monoclonal antibody for treatment for this virus infection? I mean, the vaccine is going to be a polyclonal one or monoclonal one in future?
Already, I think monoclonal one is already they have isolated. I have heard it's in Italy. I think 2 days back the news came. I'm not very sure whether it's circulated or not that much. So they have isolated that, and then they will be trying for it. Something like what we were discussing about the passive immunity. So passive immunity is actually a temporary measure. We can save the people who are sick actually, or needing oxygen or something like that. Those people, for those that will be done. But for the community, we need a vaccine. Otherwise, with the active immunity only, we can develop the herd immunity. Either by repeated infection and recovering from it, or a vaccine. These
So
are the
let
two
me let me let me
solutions.
ask me one more question. Actually, this is very
Yes.
interested as far as my country is concerned, because I actually I read some article, and then there are three strains at the moment: A, B, and C. And then C is very virulent, and that is again end up in Italy, and the B is end up in USA, and then in the subcontinent, most of the time the strain is A, but the subcontinent, what happened? All the airports are closed, and then some places what happened, the B mutated into C, and then what happened, because of the death rate is very low as far as subcontinent is concerned because of the strain A. And then what happened, the moment the lockdown is over and then airport is open up, and then what happened, there is a possibility of a, what you call it, imported infection from a foreigner, maybe the strain C. But what happened, our local people won't having the antibodies for what you call the strain C. Then what happened? The second wave of infection will be very severe, isn't it?
Yes, actually, the suggestion is not to open up the international borders. If this was done at the beginning, wherever the first epidemic started, right, then this pandemic would have been prevented. I don't know why this decision was not taken when Wuhan, that virus started, epidemic started there. If the international border was closed or that local airport, everything was closed, then we would have contained it. This time, because of the trading or our ambitious economical growth, I think the decision was taken not to close it. And many countries like Italy, it was because of the tourism they kept it open for long, and now they are facing the problem.
Okay, okay, thank you. And then I wanted to ask a question from, there's a clinical pharmacist in there, Dr. Piyush Mittal. I can see him. Piyush Mittal, are you there?
Oh yes, yes.
Piyush Mittal, are you there?
Sir,
Okay, Piyush Mittal,
hello.
can you
Hello,
tell
welcome.
Hello, hi.
hi,
Hello.
can you tell us something about this hydroxychloroquine? And then we are fond of knowing more about that because India is very much. Hello, are you there?
Hello, huh? Yes.
Yeah,
India is very
I'm
much
there.
exporting the drugs to other countries. So, what is the advantage of using the hydroxychloroquine in this viral infection? As a clinical pharmacist, can you explain us? Is there a use
Uh,
in this?
yeah, it can be used actually as a prophylaxis for the healthcare workers. But the problem with this drug is that this may cause some QT interval problem in the patients having a cardiovascular problems. So it is not that much recommended for that patients.
Oh,
So
oh, so
basically, it is
so so
acting.
it's not advisable to use it, is it?
I don't feel it is advisable. I personally not feeling that it is advisable as a first line therapy for treating as a prophylaxis treatment for that.
Uh,
So
so, so what do you think about the antiviral drugs? I mean, something like that, interferon, and then interferon. There's a lot of antiviral drugs, isn't it? And then
yes,
maybe non-specific. Can these antiviral drugs can be helpful?
it can be helpful. Just now that the trial is going on for the Radimivir, but it is not that much good for them. Also, I think the trial is going on.
Okay, thank you, Dr. Smita.
Thank you, sir. Nice meeting you here.
Thank you.
Thank you very much for your inputs.
So if there's no questions, we may take a short break and we'll resume with the next session.
Hello.
Yes, please go ahead.
Hello. I'm
Hello,
Dr.
yes,
Geeta from Bangalore. I have a
yes,
question, sir. Can you hear
yes,
me?
yes, I can
Uh,
hear.
Among the European country, there is only in Sweden they have followed a different way of facing this coronavirus. They have not done total lockdown right from the beginning. They had school for the children and shops, restaurants, everything was open. And the epidemiologist is very firm in telling that we believe on trust principle, where we just give the direction to the citizens and we just see that they follow that. But even when we see the cases, it is more of the old people death only is more there. So is their way of approaching this situation correct? That is what this that's what I wanted to know. They didn't have a total
Actually,
lockdown right from the beginning of the epidemic or the pandemic.
Actually, WHO did not say anything about lockdown. WHO told maintain social distancing. It is not lockdown. Lockdown is done by the governments to buy time to boost up their own health system and build up get ready the corona hospitals, corona treatment hospitals. For that reason, the lockdown was done. And WHO always told that you maintain the social distancing and do the hand hygiene and personal hygiene things properly. That will be enough. Now the thing is that if people are honest and then they report to the health authorities about fever and then their travel history, fever, so then travel history, then we can do the screening, right? But many times they are actually hiding the symptoms now because there is a fear that quarantine, they have to go for quarantine or they might have to be put in isolation ward, and those hospitals, they're not very comfortable. So that's why many people are hiding that, and I find that many of the hospitals are closing down because of too much of infection. That the health, the doctors and the nurses getting infected because the people are coming with normal other issues like say maybe abdomen cramps or diarrhea or something like that, and then after they get admitted, after some time, maybe 4 hours, 6 hours, so the fever starts. Then they send it for testing, and they found that it's corona positive. But by that time, he has spread the infection to many people. So this is what is happening in the European, in the Sweden. What happened is people are honest and they are very, very much. What's it say? They aggressively did the screening in the community. That is very important. So when you do lockdown, the most important thing to do is the screening. Unless you do screening, community screening, no point in doing lockdown. So we have to screen first and put the people under suspicion to quarantine or isolation, those who have the disease. And that is the main thing to be done during a lockdown. But in India, actually, that thing didn't happen. It's only the lockdown. So that's why you find now people, it's something like all is well kind of a situation. We don't know who's having the disease, who is not. And it is already everywhere.
Now it is more fearsome to go out.
But our feeling is the doctor community feels that our overall immunity is quite strong because we are subjected to so much of pollution, so much of say, unhygienic conditions in natural day-to-day life. So might be our immunity is strong, and might be it is putting up some kind of a cross immunity for this virus also. Otherwise, I would have expected many more cases and many more deaths here. That's not happened so far. So that is one good thing. But here actually people, the statistics is also not very reliable at the moment. I don't know honestly if it's reported or not, because many times there is some issues coming up in different kind of government data. People are challenging it. So we are not very sure whether the data is correct or not.
Okay. Thank you, doctor. Thank you so much.
Yes.
Okay. Thanks a lot, Dr. Ankur. I believe we are running out of time. We could start with the next session. I'll be sharing the screen. Is it okay with you?
Okay. Just in 2 minutes, I'll be back. Right?
You want to have a break?
No, I'm getting it. I'll come in 2 minutes.
Yes, please. Yes, please. You can pause your video. For all the participants here, you've got the WhatsApp number provided by Dr. Ankur, who's providing telemedicine, teleconsultation too. And we've got a team of psychiatrists who are in the panel. If you've got any questions, we've got Dr. Vinay from Department of Psychiatry. Dr. Vinay, can you hear me? Yeah. If anyone's got any questions to Dr. Vinay, you may please ask. Dr. Vinay, can you hear us? Dr. Vinay? Dr. Vinay, can you hear us? Dr. Vinay, can you take, is it okay if there's any questions been thrown to you? Okay.
Maybe there's a disturbance, isn't it?
Yeah.
Okay, Professor Rajesh,
Yes.
thank you very much for organizing this kind of webinar conference, and then discussing at the global level, and then I thank you very much because you found a correct resource person to conduct this exactly. Thank you.
Thank you so much, Doctor. Thank you so much for joining us. Hopefully, we'll have Ankur back. If Dr. Vinay could, Dr. Vinay, we've got some disturbances. We'll just wait for the speaker to be back. We may have a small break. You can just keep logged in. We have not got any interruptions for now. If in case you may have the interruption, you may just re-log in by clicking in the link that was provided to you. Thank you.
Hello, I am back, Rajesh.
Hey, Ankur, how are you?
Okay.
Hello, yes.
Yeah, we've got the speaker back with energy as such. So the session is open. I'll be sharing your slides, Dr. Ankur. Thanks a lot.
Okay, thank you very much. Welcome everybody. This is the second presentation. This is on the prevention of coronavirus infection during post-lockdown. Now, before lockdown and post-lockdown, the prevention should be the same. So do not get too much relaxed that it's post-lockdown, so I'm free to do anything. That's not the thing. We have to step up our precautionary measures. Don't actually rely on the self-immunity, because other countries we have seen moment they became very much over ambitious and they went out in groups, then the disease came back, then this outbreak came back again. So there is a chance that this coronavirus might strike back again after some time. We might get a boost of cases after the lockdown is done. So that's why always stay protected. And these precautionary measures are universal. I feel like you adapt these things one by one in your daily life. Each day, practice one thing, and then make it like a habit. So if it is within your lifestyle, then what happens is you don't have to bother about whether today corona outbreak is happening or tomorrow some other outbreak is happening. Every time you will be staying protected. So we move to the next slide. Okay, thank you very much. So here, the first thing is the head protection. So here, always try to cover the head with some kind of a hood, or if you have the surgical caps, you can use that, or even some kind of a handkerchief or something. Whenever you're going out, protect the head, because many times the virus can spread. Virus can be lying on the hair and maybe the exposed part of the head, which might be spreading the infection. When we come back home, we might actually spread the infection to our family members. So now our responsibility is to protect our family members. If we are going out, make sure that you are actually protecting your family members when you are coming back home. Next, please. Now, coming to the next thing, it is the eye protection. This is also very important. Whenever you are going out, whenever you are at home, also you can wear zero power specs if you have, or otherwise, when you are going outside, you try to use the protective goggles if you have, or safety glasses. Some people already have that. Otherwise, at least a zero power specs also will be fine, because the conjunctiva is one of the very vulnerable things where the virus can enter fast. So we need to take the protection for the eye. Next, please. Now coming to face protection. Here, always wear the mask. So if you don't have a mask, you prepare your own mask at home. There are many YouTube videos available on that, and you can use a handkerchief also. If you are using a handkerchief or any kind of homemade mask, always put a tissue paper inside, either a kitchen tissue inside, so that it's another layer of protection there. Or if you are using a 3-ply disposable surgical mask, then also put a tissue inside to have an extra layer of protection. But wear the mask whenever you are going outside, or even at home if somebody is having, if you are having cold and cough, or maybe some other family members having cold and cough, so always use the face mask. Earlier time, the WHO was telling that there is not required, but now they have allowed everybody to use the face mask wherever possible. And this advice should go on lifelong. Like whenever you are going outside, wear the mask because it will protect you from the pollution also. Now, coming to hand washing, this is very important. Remove all the jewelry of the hands before you wash the hands, and then you can use the soap and water, or otherwise if you're using a hand sanitizer, that should have more than 60% alcohol in that hand sanitizer. Now, whenever you are touching any object, right, whether it is inside the room or outside the, especially when you're going outside and if you're touching any object, always use the sanitizer immediately, because hand sanitizers are effective only for 2-3 minutes. So don't think so in the morning I put once and then at the end of the day nothing will happen. That is not the thing. So whenever possible, you use the hand sanitizer or the soap and water. Clean your hands very frequently, maybe hourly once at least. Okay, next. Now, whenever you are doing any kind of financial transactions like buying anything or ordering something online, always go for the online mode of payment wherever possible, because the money is the thing through which notes and coins, through which the virus spread can happen very fast. And we don't know from where that money is coming, how many people are touching it, who is touching it, we don't know, right? So, and if you are touching the money, try to use the liquid hand sanitizer or something like that, and put try to mop it on the money or on the coin so that it is sterilized, and then you clean your hands also immediately. So this is one very important message. Then outside the house, outside your main door, you can keep a bucket or a tumbler where the groceries, like the people who are bringing your groceries and other food items, they can drop their things there. Don't allow anybody to come inside the room, especially till the pandemic subsides. So this is very important message. People should not enter your house. And you can use a surgical spirit to sterilize it from time to time. Surgical spirit is available in the pharmaceutical shops. That is very important item for your disinfection. Now, when you are going outside, after that, when you come back, right, immediately go to the washroom and then remove all your clothes and put them in detergent solution and take a shower with soap and water. This is very important thing before you enter other parts of the house. This habit will make it lifetime from now onwards. Whenever you are going outside, come back and then take a shower and then clean up everything. Next, please. Now, whenever some shopping item comes, something you have ordered, somebody has given you the grocery items and the food items and all. Suppose it is covered on the surface of the packet, you need to clean it by surgical spirit or any kind of antiseptic solution. You can use the Dettol water also, if surgical spirit is not there. So this is very important to clean the surface of any kind of item before bringing it inside the house. And immediately clean your hands also, wash your hands also. Now coming to the fruits and vegetables, what do you do? The eatable things. Fruits and vegetables, what you do is you submerge them in a bucket of water with vinegar and baking soda for 20 minutes. Let them stay there for 20 minutes and then you remove them. And then you can dry them in the kitchen tissue and then keep them in the refrigerator. Next, please. Then we have to safeguard the elderly because they are the vulnerable population. So this is one advice, like even after the lockdown also, always isolate the elderly at home, and those who are pregnant ladies or those who are having kind of debilitating disease, they should be isolated at home. That means wherever possible, you put them in a master bedroom with a bed and a attached bathroom, and one person should be attending them, and that person should not be meeting anyone outside. So this is very important thing. So whenever you are, when the lockdown is over and you are frequently going outside, make sure that is elderly inside the house and those vulnerable people, they are protected. So do not take a chance, right? So isolation for this vulnerable group is very important even after the lockdown. This is a very important message. Next. The social distancing. This is the thing which we should actually continue for the rest of our life. The first thing is wherever possible, we try not to visit the marketplace or the busy shopping malls wherever possible, and that will increase the chance of getting disease from others. And now we can increase our online shopping thing instead of physically going outside. So this way we can protect ourselves also. So online shopping will be the future basically for most of the people, those who can afford it. Next, please. And this is a very important message. Another one: do not touch anyone from now onwards in the rest of your life. So here, actually, we should avoid the handshakes, hugging, kissing, and or patting somebody. And just use the namaste posture or the or even say waving the hands or salute to greet people. This is the most important message. Try avoid touching people when we are outside. Next thing, next slide, please. Now, this is the social distancing norm. Always maintain 6 feet distance, that is 2-meter distance from everyone when you go outside. So this one, later on also, even after this pandemic subside, then also you can follow this one wherever possible. So especially those who are elderly, I'll suggest this thing to follow for the rest of their lives. Next. Now here are the most important, these vulnerable groups here, the elderly and those who have weakened immune systems and the pregnant ladies. These are our vulnerable population. They need to be isolated and protected even after the lockdowns. This is very important message. Everybody should identify the persons who are vulnerable in the house and protect them.
Okay, thanks.
Yes, and this thing is whenever there might be intermittent lockdowns, because whenever after the lockdown is taken back and when people start mixing, after some time there will be an increase in the case. So that time again there might be a lockdown called. So if the government is calling for a lockdown, you just obey that one and stay inside the house. And in the last presentation, I have told how you can utilize your time best way at home. So follow that one. Next, please. So this is our idea to flatten the curve. That means to reduce the load in the hospitals, because we don't have enough hospitals in India according to the population. So, and then very less ventilators and very less ICUs. So this is a very important issue there. So always try to stay home and stay safe and avoid getting into hospitals in that situation. So nowadays, most of the doctors are doing telemedicine work, so you can consult them over the phone or over WhatsApp or over video calling on the Skype, and they will be able to assess your situation and give you the medicines. So try to manage most of the things from home. Try not to go out. Next, please. So we have come to the end of this presentation. I'll be happy to take your questions now. And all my presentation slides are actually converted into videos and they are available in the YouTube. So if you want for a future reference, you can get into the YouTube. You just type the title of this presentation and you'll be getting the relevant videos there.
Hello, good afternoon, sir.
Yes, good afternoon.
Sir, I am calling from Malared Institute of Pharmaceutical Sciences, Hyderabad.
Yes, welcome, sir.
So, your session was very good, sir. But I have some doubts. Like as you said, like we should be very careful post lockdown.
Yes.
Like specifically for allergic rhinitis, like my son is suffering from allergic rhinitis. Usually, he'll be having allergic to dust and all. What precautions you suggest?
The first thing you do is whenever somebody is having allergic rhinitis, I suggest that you wear the face mask, like the three surgical face masks, the 3-ply surgical face mask. That one you can buy and put a kitchen tissue, layer of kitchen tissue inside that. So whenever you are going out, this is very important because the pollution and maybe some dust that might create problems, right?
Yeah, and
So always this precaution has to be there. Then the next thing is required is there is a video there. I have made a YouTube video on the lifestyle modification. So that one, if you get some time, you can run it. There actually another important advice will be to take the steam inhalation with maybe some menthol or eucalyptus oil, right? Steam
okay,
inhalation.
yeah.
So that
Usually,
is
yeah,
twice a day. Yes, twice a day will be required, right?
yeah.
Then the other thing will be warm saline gargle. Gargling maybe half cup of water, you put 2 teaspoons of salt, make it a super saturated one, and then gargle it. Keep in mouth for maybe when you're gargling, keep in for at least 3 minutes. So 3 sets of gargling if you are doing, so you'll be spending around 10 minutes, right? 10 minutes in the
Yeah.
morning before starting the day and 10 minutes at night when you come back home. So the steam and gargling again you do after coming back from home. Then what happens? Most of the dust and the germs, they will be actually destroyed and they won't be there, right?
Okay. And one more thing is regarding in the schools, like usually sometimes they won't maintain the hygiene, like this what you call sanitizer. If you are giving, I think is it sufficient or
Yes,
sometimes
actually,
wash?
hand sanitizer, suppose you are not getting it, tonight itself I'll be uploading a video on the YouTube regarding how you can prepare hand sanitizer at home. It will be following the WHO norms. Along with that, some kind of Ayurvedic oils we can add to enrich it. So I'll be giving you those permutation combination formulas. So you can prepare your own hand sanitizer at home, and it will be cheaper also, and you can use it
No,
anytime.
in fact, I have prepared some and I am using it. Uh, Means what I mean to ask you is sanitizers will be sufficient for the children in the schools. Like they are not always they'll be in contact with their other students also. So how effective do you think only sanitizer will and mask will be sufficient? Help
This is
them
actually
preventing this.
mask, cap, sanitizer, and a specs. These are the things you can do for the time
Yeah.
being. But this spreads through direct contacts and fomites also, right? So
Yeah.
maybe the dress, like after they come back from school, immediately take out the dress, put them in the washroom, and then take out the dress, put it in the soap and water, and give them a thorough shower after with soap and water. That will be important actually. This one will be a part of life actually. Don't actually forget it after the corona is not there. So this corona one
Yeah.
way, it is actually teaching us many good things. So we have to
Yeah. Yeah.
be looking at
We are
that positive
becoming more
aspect of it.
hygienic.
Yes, yes, actually, this way, and you see, people are becoming more creative also. At home, many people are becoming very good cooks, and then many
Yeah.
people are becoming artists, singers, dancers. All these things, all these creative things are coming up. So these are all the positive aspect of it, and they will make
Yes.
you happy also. See, so many years you didn't get a chance to do anything. So always look at this thing. This lockdown is actually a very good thing. It's just like your retired life you have got back. So something like that. You are getting back in advance the retired life. So instead of
Yeah.
complaining, do that, but if you stay protected, you will be surviving. What I feel like,
Yes,
whatever
yes.
WHO guidelines are there for personal
Yeah.
protection, hand hygiene, and all, if you are practicing it, you will be surviving, no problem. And then this thing regarding some immune boosting things, also I have given some videos in my YouTube channel. You'll be getting it. So those are
Yeah.
home available ingredients. With that only, if you are preparing a lime juice or even golden milk solution or something like that, those things if we take regularly, automatically our immunity will be strong. Then taking the yogurt or curd every day, our gut immunity
Mhm.
also will be strong. So if we are strong, nothing to worry actually. The virus will come and go. Only thing is our elderly, a vulnerable group at home, they should not get
Yeah.
the infection from us. This is our main concern.
Yes, yes, yes. Yeah, thank you, sir. Thanks a lot for your information.
Dr.
Thank
Ankur,
you very much. Yes.
Dr. Ankur, this is
Yes,
Dr.
please.
Jiva,
Yes, please.
Dr.
Yes, welcome, sir.
The Sri Lankan College of Microbiologists, they came out with some guidelines regarding the disinfecting the person, right? So you can see as far as India is concerned and Sri Lanka is concerned, some the disinfecting chamber coming in front of malls as well as in front of officers, and then the people have to go through the disinfecting chambers, right? And then they are using various disinfectants like that alcohol, something I don't know what they are using. And then the Sri Lankan College of Microbiologists, they warn the use of disinfecting chambers as far as because they say if your hands are not clean, right, and then
Yes,
no
yes.
point of cleaning your body.
Yes, yes.
And then so say
Actually, here actually what happens is basic thing what the WHO told, that one has to be practiced: hand hygiene and personal hygiene.
yeah,
There is
but they
no exception to that, and all other things are added up. Like
yeah because
whatever
they
other things we do,
now they are
we can add it up.
they are spraying the body, right?
Yes,
but
yes,
your
yes.
hand is contaminated, no point, isn't it?
No, actually, we all have to make a habit nowadays to carry a hand sanitizer, small bottle of hand sanitizer in our pockets. So
Yeah,
this
because
has to, our lifestyle has to change now. So this has
yeah,
to be
that's what
there.
when you
Because in
go to the
many remote areas, you might not get water, you might not get soap, right? When you're outside, so it's not possible. So
exactly
instead of that,
so,
you carry the hand sanitizer.
so when you
Yes,
go through the chambers they spray, right? So this can
yes.
cause skin irritant, and some of the people can cause some respiratory problem also, isn't it?
Yes,
For
yes, there is a chance actually. There is a chance because we don't know how our body will react, right? Everything is not, every person cannot take all the things lightly. So, if there is any kind of what I say is allergic reaction or something, then take the anti-allergic like Avil, chlorpheniramine maleate that can be taken. And then suppose say there is some skin allergy or something for hand sanitizer, you can use some kind of tea tree oil or maybe clove oil. These things are or olive oil. These things will be much more helpful
and
to protect the
and then
hands. Yeah.
I want your expertise also in this knowledge. There are two kind of hand sanitizers people are using. One is the liquid type and the jelly type. And
Yes.
and then which is actually more advantageous? I mean,
Actually, this thing both are acceptable. The gel-based one is basically aloe vera is more there, more content is aloe vera, and the liquid one is having glycerin. So these are the two difference there.
yeah,
And WHO is recommending your this one alcohol should be surgical spirit, that is more than 90, I think more than 90
70%, is it?
95%, more than 95%. That is the surgical spirit. 95 and 99.8, something like that.
Okay.
96 and 99.8. These are the two
Oh,
formula they have given. That is coming in
so,
the surgical spirits.
yeah,
And then and
some
the
of the
other
farmers,
thing is your hydrogen peroxide. Hydrogen peroxide 3% has to be added there, and then the glycerol.
some of the
So these are
pharmacies
the
are
three
selling
things.
the isopropyl alcohol.
Yes,
Can you use that?
yes, that is our rubbing alcohol or the surgical spirit. So
Oh,
it can be diluted to 70%. So they might be diluting it to 70%.
okay.
But as long as the content is more than 60, WHO is happy with it.
Okay. Thank you.
Thank
Dr.
you.
Ankur, one question
Yes,
from my side again, Geeta.
Yes, yes.
Why
Tell
is
me.
COVID-19 so much in concern compared to the older ones, SARS and MERS?
This time, actually, the media hype. I have a feeling like that. Otherwise, I don't know. I don't know whether any international some kind of a thing is there or not. We have to see when the vaccine comes in the market, how much business happens and who gets the business. So there could be something there in the international level. We don't know. And it's many people feel that it's a artificially created one rather than it's a normal one happening. That is also another theory is going on there. So we don't know with what intention that is there. But nowadays, because of the media is hype, everybody is getting tensed. So this is it. Like we are here because of the COVID only, right? Otherwise, we might not be knowing each other, isn't it?
Correct,
So,
correct.
so this is actually the media hype. But I feel like we have to just protect
Because
our
SARS, MERS,
elderly.
everything is from Corona family only.
Yes, and
But
that
that
time
was
actually
not
what
so much
happened?
hype.
No, and that time actually immediately the international borders were closed, and then
Okay.
it was contained because wherever there is an outbreak, if the international borders are closed and the domestic borders are closed, then it won't spread. It won't spread. But here, I don't know why this has happened and with what intention. Why those people were allowed to come out of that place where the outbreak happened. I don't know why other countries accepted them. Something happened there. It looks like a planned way. I don't know.
Okay, okay, thank you.
Yes, yes,
Hello, good afternoon, sir.
yes,
Sir, this is Dr. Deepa from JSS College of Pharmacy. Sir,
yes, please.
what I observing from the people, when they're talking with the people, they're just removing the mask and after talking again, they're using that. And most of the people, they are using dupatta and kerchief and all. When we are using mask, we know which is inside, which one is outside. But what about dupatta and the kerchief and all? And
If somebody is using dupatta or
to use
is
the mask.
yes, how to use the mask is actually the nose and the mouth should be totally airtight. Basically, that has to be. I mean, as close as possible, not airtight. It's like as close as possible so that outside any kind of foreign particle doesn't go in. Because we have to breathe, right? We cannot have a what's it called, a plastic mask or something like that. So this is a thing. It has to be cotton thing or the cloth one. And if you are using a surgical mask, 3-ply, then what I have suggested already is use a kitchen tissue inside that, a layer of kitchen tissue. So that will be quite close to your N95. And then the next thing is, suppose you are using a handkerchief or any cloth to cover the nose. There also you use the kitchen tissue. Put a layer of the tissue inside so that it gives you extra protection. Right, and my advice will be not to remove the mask at any point of time, even if you're talking to somebody. Like I find when the media is interviewing someone, the people are removing the mask and then talking. It's not required actually, and that is again the purpose is not met if it is removed, especially when person is outside.
So one more doubt: washing vegetables. Have you used rock salt instead of using baking soda?
What is it?
Washing
what
vegetables.
Salt? Yes, yes,
rock,
yes.
Rock salt, yeah.
Yes, yes. Rock salt you give a little more. Yes, yes. You can use vinegar is a must. After that, you can use the rock salt also. Rock salt, if you are giving, you give like say maybe two teaspoon or 3 teaspoons, something like that, based on the thing. Suppose it's a 2 liter or 3 liter water, you can use the 2 liter for 2 teaspoon, 3 liter for 3 teaspoon. Give a little more. If it is super saturated, it will kill everything.
Yes, sir. Thank you, sir.
Yes. Any other question?
Okay.
Hello, sir. This is Pulak Majumdar from Adi Chinchini College of Pharmacy.
Yes, please.
Sir, as we know that there is no treatment for this viral disease. So, but there are newses we can see that people has been cured after treatment. So, what sort of treatment they are giving for this particular disease?
This one, the disease 80% is actually maybe mild, right? So if the mild form of the disease is there, it is symptomatic treatment will do, just as we treat for flu, common cold and cough. So it's just like lemon, antioxidant, multivitamins, then your steam inhalation, then one anti-allergic, maybe paracetamol for fever, these kind of things, and gargle, warm saline gargle. These are the things with which you can manage this in the milder stage. But when the respiratory problem comes, if there is a respiratory distress or very much copious cough is coming out and it is becoming like at night it is more. So that time we might have to think about pneumonia also. So maybe that time treat the pneumonia, and if required we need the inhalers and maybe nebulizers also at a severe stage. And then if that doesn't, we cannot manage it at home at that level with the nebulizer also, it's not working, then shift to the hospital. Nowadays, remember that in hospital, there is a big problem there because people are very scared about this virus. It has come to the community, right? So many hospitals are not actually accepting anybody with fever or respiratory thing even in the emergency also. So this is a big problem.
Yeah, we've got a question. Dr. Anand Vijay.
Okay, thank you, sir.
Okay, I suppose if we could stop the question and answer session, we are ready to jump into the session that we are waiting for a long while, being an academicians. I suppose if you're okay with it, Dr. Ankur, if you could start with the next session, is it okay with you? Can I share?
Okay. Yes.
Thanks a lot. I will be sharing this.
HbA1c, okay.
Sir, இந்த பொண்ணு பண்ணிட்டா ரோசன்
சொல்லு
ரோசன் சாரி சங்கீதா
ஓகே
செஷனல் பத்தி ஏதாவது தெரிஞ்சுதானே எனக்கு
ஒன்றும் தெரியலன்னு சொல்லிடு அவ்வளோதான் சொல்லிடுறேன்.
Yes. Welcome all of you. We are presenting the next. We are going to the next presentation. It's learning the future perspective. So here basically we'll be dealing with the e-learning thing, and this is how the coronavirus has changed our life now. Most of the things will be online, like our medical practice will be telemedicine, our education will be e-learning. So as we are teachers also, so we have to add up some of the e-learning tools to make the audience to grab the attention of the audience. So here we see as the internet is developing, internet speed is improving, people are having more of electronic gadgets. We are actually moving our learning things to e-learning mode now. Nowadays, traditional learning is taking a backseat slowly. Like in this COVID lockdown also, we are learning a lot of things from the net, isn't it? Many times webinars, seminars like we are presenting now, we are discussing so many things. I am learning from you, you are learning from me. So this is how this is happening. This is the future of learning. We should not actually waste time in traveling and going to some place for learning. So the knowledge should be everywhere. Only problem is right to knowledge is not accepted everywhere. It's a pricey thing many places. That's the thing. Otherwise, knowledge should have been our fundamental rights. So here we see the most important thing nowadays in the learning part is the micro learning. So nowadays the modules are becoming very small, and we are focusing to small topics and small group discussions. Group discussions is the main way of learning nowadays rather than didactic lectures. Then we have the personalized learning. Here actually the learners are given the freedom to learn the things whenever they are free. Only problem is for e-learning, any kind of e-learning thing, the learner should be motivated. That's all. If he is not motivated, nothing can be done. If the person is not motivated, then we have to get back to the traditional thing. But this e-learning is a thing where the learner should be motivated, and then we create interest. And nowadays, the another important thing has come up is the gamification of learning. So this is, we'll see some softwares, how this gamification can be done, incorporated in our learning to make it interesting, so that the people are engaged, the learners are engaged, and they know the things, and we also can assess whether they have learned it or not. Now, the future is coming up as artificial intelligence, the machine learning. So this is already there, and many of the medical learning or health related issues, we have already gone into this artificial intelligence thing. So this is the future of our learning, and we have to accept these things slowly. That means, slowly the teacher profession might not be there in the future. And this is another thing, like the functional MRI pattern, which can be used for automated learning, where the learning can be imparted directly in the mind of the people without the person being attentive or anything like that. So this is something like brainwashing. So this one, the government approval might not be there, because this can be exploited to many other things. So that's why this automated learning might not be coming in near future, but later on it will be there somewhere. And that time the teachers will be not existing at all. So that kind of a situation will happen. Now, coming to e-learning things, let us see some of the tools with which we can create our learning materials and make it more interesting. So far, I have used only the PowerPoint. Even this YouTube videos are actually converted into, the PowerPoints converted into videos. But there I have not put this lecture, what I am delivering right now. This kind of engaging talk is not there. It's only the slides there. So you can use so many slides, then maybe pictures to grab the attention of the person, and then clarify your thoughts. So this is very important. So even if you're using a PowerPoint, make sure that the main message is there, and people should not have to read too much. The core content or the key message, you are putting it in the PowerPoint in form of a summary, so that they understand what it is. They don't have to look anywhere else for details. Now, these are some of the tools you see. The Microsoft Office one, this is very, all of us are using here. The PowerPoint is a very important tool. Microsoft Word is a tool. You can convert the Word into PDF file and share. And then the Excel is for calculation part. For research work, it will be useful. And next, we find very useful thing is the YouTube one. The YouTube has got a good collection of videos, and many people are uploading the learning materials, and it is accessing is free. This is one important thing there. And only problem is that many people, without their knowledge, they are actually, the quality of the video is not graded anywhere, and the information, you don't know whether it is something of a misinformation or wrong information. That you have to judge. So that's why after seeing the videos, you have to do this kind of work. Next thing is Adobe Captive. This is one of the e-learning software which is also useful there, and it has got the interaction layouts, and also the games can be done there. This one is also not a very costly equipment. Then coming to Canva. This is another tool for e-learning, which is for infographic. Infographic is something like a pamphlet or some poster where you put the images, and the image will be in a flowchart sort of a thing, giving the message. Like the health ministries provide so many information in form of pamphlets, those are infographics. So that can be done by this software. Next, coming to this one, Grammarly. Grammarly is actually a software which corrects the grammar, because most of the time when we prepare any kind of e-learning material, there could be grammatical errors. Without our knowledge, it happens, right? And this Grammarly is a very intelligent software which corrects it and then makes it very presentable and very simple for the person to understand. Then we need some images, right, to make it like visually attractive. So this Pixels is having a good collection of image, and we can, those are for, if we take the subscription, then we'll be able to use those image in our presentation. So, but otherwise, if you are using the Google image, you are going for the, you can go for the check the licensing thing there. If it is without license, or it can be used by the common forum, then you can use this image, which doesn't have any kind of copyright restriction. Otherwise, if your presentation later on is for monetization, then there will be problem. Now, for information, they don't charge anything. Nobody is going to tell you anything if you are spreading the information using those images. But if you're not, if you're charging money, then comes the copyright. Now, this our articulates of storyline that will be again dealing with it later. Even you'll see that these are the very these are the costly ones, costly package, but they have everything there, including your content development plus engaging materials like quiz, then your gamification, everything will be there. Now, e-learning engagement tools. First, we developed our e-learning materials. Now we are looking into the engagement, how to engage our audience here, so that they look into our materials and then they learn it. Next slide, please. Now we can use EPBL, something like a problem-based learning or a project-based learning. Based on the needs of the institution, you can modify that, either problem-based or project-based. These are for encouraging teamwork and analytical thinking. Next, please. Now here the students get, those who are actually in the project or solving a problem, it is a group activity and it develops the leadership quality and also the participation and responsibility also. So here people are working as a group and this group should be small, maybe 4 to 6, not more than that. So this is also a part of micro learning. And then Google Drive. Google Drive is very useful for conducting this kind of problem-based learning sort of a thing, and where the study materials can be uploaded on Google Drive and it can be shared by these participants. So it's a one source and they can do, and then in one document they can simultaneously do the editing. Suppose they are writing a report from different parts of the world, they can sit and write the report simultaneously. Then comes to an important software called Animoto. Animoto is a fun tool which actually animates the thing. Whenever you are putting a video, photo, or a text, it has the capacity to animate and add some kind of a movement in the presentation. Then comes the DPT. DPT is actually a browser thumb tool for sharing projects on interactive timeline. It is actually basically it can be used in the social media also, and it's a something like a mind mapping content which are usually used by the social science department and the history department. They have the timeline kind of facility also to put up there. Then MindNote, this is actually another important one. This is a mind mapping application. This is basically made for mind mapping, unlike the previous one. This is a totally mind mapping thing. This is useful for even research work also. When we are planning something initially, we do the mind mapping. So, or even a curriculum development purpose, we can use this kind of software. Then Evernote is actually for taking small notes and create to-do lists, checklist sort of a thing we can maintain there, and then it can capture photos and records just like other software also. So this is also very important for discussion part or sharing information in small group micro teaching. Then of course the Twitter. Sometimes if you don't have you don't want to invest in anything, you can use a Twitter also for this purpose. The Twitter handle can be used for some kind of a discussions and something. Then we can use the hashtags for discussion part and putting up the views from other people under the same hashtag. So these are the things which can be used. Twitter also can be used for the teaching purpose. Now coming to webinars, just like the webinars we are having now, the Zoom. So these webinars can be used for seminar presentations. Whenever the students, you have the postgraduate students or the undergraduate student, they need to present seminars, you can make them into smaller groups and then we can use the webinars. But the Zoom can support many. The free end, I think, is 100 they are supporting, and when we are going for the paid one, it's around 2,000 to 3,000 viewers can be supported there. But these webinars are very important thing nowadays for even for the doctors CME programs also, continued medical education. So this kind of through this we can reach to many people at the same point of time, and people from different parts of the world, they can actually interact. And this is very important. Otherwise, it's very difficult for us to come physically for a seminar, and it's very costly. So this is the thing which is the cheapest one, and we can share our views, talk to each other, know each other, and learn new things also. So this is the most important e-learning thing nowadays. And majority people nowadays are using the Zoom because it is supporting many attendees at the same time. Other softwares are not having too many there. Like WebEx is having 25 attendees. There is some restriction there unless you go for the paid one. And then there is hardly anything to choose between these. Only thing is how much bandwidth is required and how many participants they are supporting. And some of the softwares, they support the whiteboard also, where the presenter can write something and it can be seen by the others. So whiteboard support is not there for all the tools. Now Join Me is another one which is very good for streaming, and this kind of video streaming and then presentations. And Zoho is another one. Zoho is also a user-friendly web conferencing software, which is quite popular in the Western side. And it is also used for sharing information, and then you're sharing the PowerPoint slides or the videos. Supports everything. And then suppose you need a personal web conferencing platform, then webinar tool, on-stream meetings are there. These are actually basically for the corporates, but it can be used in the by the e-learning team for their own meetings and hosting, sharing ideas for curriculum development. But whenever we are looking for large amount of students, then we need the Zoom. Now, any meeting is also another useful tool, which is for webinar hosting. But these are having limitations. Like there will be small amount of participants, maybe 20 to 30, not more than that. But they support all the forms of files sharing and video sharing, and also the audio sharing. Now coming to quiz. Quiz is another important aspect which can be applied to any kind of presentation to make it interesting. I hope everybody likes the quiz, right? So whenever you are putting a quiz, you can actually give some awards also if possible, right? Many token of, or otherwise token of appreciation. Then also the people will feel good, or maybe virtual awards. Nowadays we are not meeting anywhere, so it can be virtual awards can be given for the quiz. So this is if this is a part of the teaching thing, then what happens is you can evaluate whether the person is listening to your things or not, and whether the key message they have understood or not. The quiz should be based on the key message of the presentation, so that you know people understood those key things, the most essential ones. Then Poll Everywhere is another very useful tool. This one is I mean, it's freely available, and some part of it is paid also, the fuller version. But the free available also can support your small group teaching. So here, after presentation, you can have the MCQ questions, and the audience can give the answer, and that will be visualized on your presentation screen. How many people have opted for A, B, C, something like that. Then Classmaker is also similar kind of a software. Here actually what happens is that people will be seeing how many, there will be a live presentation, like the bar will be moving up from A, B, C, whichever the people are opting for more options. This is something like in reality shows, whenever we do polling, that kind of an activity will be happening in the class when you are using this kind of quiz tools. The activity is also like another quiz tool, where it will be displaying the results immediately on the screen after the poll is taken. and they all have the analytics. How many people, whoever has logged in, and their responses, everything you can analyze and see. How many male, female, all those things you can analyze for your research work also. Now, top grade is another tool for creating quiz. This can also have the flashcards, and then they can have the match the following type of questions also can be added here. Then FlexiQuiz. FlexiQuiz is also very easy using tool. These softwares actually, whenever you are interested, you can actually get into the application videos which are available on the YouTube. You can have a feel of it, how they work. So later on, when you have a e-learning team in your university or college, you can discuss that some of the tools which are useful you can do. But I advise that everybody go for the free things first, get used to it, and then when you want to use it more regularly, that time you go for the paid ones. Otherwise, without the attitude of preparing the e-learning materials, if the institute is buying big softwares, it will be costing a lot and people won't be utilizing it. Remember that these e-learning things, they need a lot of time. They need a lot of time than our usual teaching time. Almost like 4 times more than our usual teaching time. So it's not an easy thing. It is a time-taking thing, and it needs a lot of skill also to for graphic designing, then for color combination, and what's it called, the presentation materials. So now coming to gamification, this is the future of our e-learning thing. These softwares, they will be actually adding the some kind of a game to make people interested in that learning activity, and then when they are engaged, their understanding will improve. So this is the most important aspect nowadays. Wherever possible, you can add some kind of a game, either a quiz or a game if you add, because you won't get much of time. Each session, I will advise like finish each thing within say 20 minutes, your content. After that, you put these games and things there. Or in between, you can put, after one topic is over, you can put one quiz, 1 or 2 questions or the games there. So here also the articulate storyline, this is supporting everything. This if you go for this software, this will be your, I think many people can use it, and it has got all the features here, what we need for our e-learning. Then Activity is also another gaming tool. This one, if you get a chance to, all these things, all these softwares, they have a demo version. You can go for a demo, or then there is a free trial for 14 days. So you can run those things and see, have a feel how they are working. Then iSpring is another software which is also used for gamification, and then quiz and some kind of interaction there. So these are the things, and where simple PowerPoint things can be converted into interactive things, even for articulate storyline also. So these are the, you don't have to, if you're comfortable with PowerPoint, with that only you create the materials. After that, this software will suggest you how to make it interesting. Then Adobe Captive, this one is also another useful tool for the gaming purpose, but this is not very much exploited so far, this gaming tool. But it is also a useful one, and it can support the PowerPoint. Then you see that this is another intelligent tool like our articulate storyline, which can actually make the presentation very interesting, and then add the gamification thing there, some kind of a game, or say mind game, this kind of things is their thought-provoking thing. Then the people will get more attracted to it. But as I told, after don't get into this gamification without developing the content. Developing the content is the most important thing, and make sure that you present it, the key message, whatever you want to teach, right? The essence of it should be there, and then you choose some image there, image or videos to explain it further. And then after that, you add this quiz or the games for engagement. And then suppose you are doing small group discussion or micro teaching, you can use the EPBLs, project-based learning or problem-based learning. So these are the package of the things, whatever is so far doing well. I have collected everything together, and it is now you to decide which tool you are going to use it at, for what purpose. I feel that each month you can try one thing and don't pay anything for the beginning. Go for the free trial or go for the videos which are available on the YouTube and have a look at it how things are there, right? How people are using that tool to create their own videos and how to use that tool. Those videos are also available. So utilize the YouTube for learning the things and go to the individual website of every software and take the free trial and have a look at it. And then maybe if you are interested, you can actually talk to your e-learning cell and then suggest them some software which you feel like people are using more. They can have a discussion and they can see how many faculties are going for that software. So one software can be taken by the full license can be taken by the institution for developing the content. But this e-learning thing is the future, and many courses in future partly will be e-learning thing. And then might be if the lockdown is going on for a long time or the social distancing is going on for a long time, we might not have our seminars or conference physically. We might not be able to attend it. So our only option will be through these webinars. So these are the things we have to decide how we go about it. But always, if you are not techno savvy, or if you are feeling that okay, I am very afraid of using computers and all, somehow get interested and learn the thing, because if you are not learning it now, you will be miles ahead, because this is the future. If you are not going with the time, you will be totally left behind. So please, those who are in the teaching, right, I'll advise everybody to use some kind of e-learning tool and start with the PowerPoint. That is the basic thing, right? Start with the PowerPoint. Nowadays, PowerPoint has got a lot of features. Even you can convert the PowerPoint things into videos. You can record your presentation along with the slides and then make it into a video also. That is also possible. So these are the things you can do on your own. Try to see what you can do on your own. Then later on, if you are going for a better thing like animation, gaming or something, then you need support from the IT cell or your e-learning department, right? So thank you very much for your patient hearing. I'll be looking forward for your questions.
This session is open for questions. Thank you.
Dr. Ankur?
Yes, welcome.
This is Viva again. This is regarding Ankur. This you are talking about the learning resources as well as the use of learning resources in the COVID-19 control. One of the questions I wanted to ask you always, you know, the Kerala model is considered as one of the best model controlling the COVID-19. Sri Lanka is not far behind Kerala. We also very good control of COVID-19, only 9 deaths and then less than 1,000 infected. And is that the reason the literacy rate of that state helping for the Kerala
this
to control?
Is actually, yes, you are right. Actually, literacy rate and the motivation of the people. The people should be motivated and they should be helping the government. Otherwise, it won't work. Otherwise, you see what the WHO have said, Kerala has done the exactly same thing. If you are doing lockdown, do aggressive screening, right? And then isolate the people, those who have the disease, and then you quarantine those who are actually associated with came in touch with those cases. So these are the two principles which has to be followed, and they have followed it very nicely. But other places actually they could not control. I think some people from they became very disorganized, and then they created problems. They were crowding, and so the purpose was not met. Other places.
There's another one is actually USA failed, but
Yes.
Canada succeeded. How?
Yes. USA, I think they took it very lightly. I have a feeling like that. These European countries and US, because their health system is so high organized, so they took it very lightly. They thought that their population has got good immunity, so people will develop hard immunity, nothing will happen, and if whatever cases come, they can treat them properly. This was their understanding. But the thing is that in public health, if you look at it, too much of cleanliness is actually not good for public health. Since we are actually subjected to dirt, pollution, and all the stuff, that is somehow it is helping us, because every day our body is fighting with so many organisms, right? And they are not exposed. Their immunity is like a virgin immunity, might be. It's not exposed to so many things. So suddenly something came and they could not take it properly. It is something like the individual immunity, I think, which has created a problem. Otherwise, no. Otherwise, this kind of catastrophe cannot happen. And we are actually, our countries, we are trying our level best not to increase the case in the hospital, because we know our system. Suppose the cases come, already those who are coming, we are unable to do too much about it, right? Those are going to the ventilator, almost going. We are losing them. So this is the thing. We should limit them as much as possible for getting into the hospitalization condition.
Okay, thank you. I can see Dr. Shiva David. Welcome. Thank you for Can you hear Shiva?
Yes, that's right. Just give me a minute.
Okay, nice to see you.
Oh,
again.
welcome back.
Yes, yes. Hi, Dr. Ankur, and hi, Dr. Barua. Nice to see you after quite some time.
Yes.
Okay, let me introduce myself
Welcome.
for everyone else. I'm Dr. Shiva David. I'm from University Brunei Darussalam. I'm a senior assistant professor in pharmacy. That was really informative, and you had really covered up all the portions that we were talking about in e-learning, and especially it was very concise, giving us all the tools. Quite an informative session. I really enjoyed it thoroughly. I have just 2 questions for you. Now, we are definitely using e-learning quite a lot, and for us in Brunei, it's a very small country, and we started, it's not a lockdown, but we closed working from home starting on 16th of March. So we have an experience of about 2 months of working from home, and even our exams are being conducted through online things that are happening. But there's one constraint that we see is the bandwidth that we have. And as you had already discussed, some of the tools, they really take a lot of bandwidth. So we have a bit of a problem even with developed countries. So how do you think we can help our students, and especially all the academics who are thinking about it in India?
Actually, as it's a very good question, and all the time we are worried about the bandwidth, right? So even that e-learning cannot, thrive unless we have a good bandwidth anywhere. But what I find is we play simple. So many tools I have told, right? Finally, if you look into very small things, say the Google Drive, that is like, it's our Gmail basically, it's associated with that. That one won't take much of your bandwidth. Then the YouTube, that also won't take much of your bandwidth. The other thing is our maybe PowerPoint, right? So these things, these 3 tools, if we can use it properly, we can actually create good materials, and then we put it up in the YouTube, or we send by email, or maybe through WhatsApp or something, and we can actually stay in touch. We can continue our teaching. So even say a PDF file, we can actually make it like an infographic, something sort of a thing, and then make it like a PDF file or like a image and send it there. So only thing is we need a lot of time. More and more you become like simple, you have to give a lot of time. It will eat up a lot of time to make things simpler. So this is one thing, and choose the image which is right, and then it does not be a very heavy image, right? It should be very light one, doesn't have doesn't have too much of pixels and all the stuff, so that it's not eating up the internet line. So these are the things we have to think forward. First, I'll suggest that you go from simple to complex one. We don't have to get into too much like professional thing, because our student, moment they get the message, right, what has to be done and what is the main essence of it, they'll be happy. They'll be happy, because nobody wants to read too many big books nowadays. The concentration level is decreasing as we are moving out. So no point in explaining too much. Just give them the main essence of it. Whatever topic you are teaching, right? What is the main carry home message? That is what is important. They should not miss out on that. So this is the thing which you can think of. And thanks to Corona, actually, since we are locked down, we are at home, this is the time to devote time for e-learning. This is the time you can create good materials for e-learning. Other times it won't happen. Once you have to go to the institute and do so many other works, you won't get time for developing your own things. Nowadays, this is the thing. That's why maybe in future, our universities also, or our workplace also won't be having like a 5-day work. It might be like a 4th day and might be reduced to 3 days also. Because we know the potential of people working from home. This is a very good thing. Only problem is your life might become hell, because all that time there is no like a holiday. There is no like a nothing like a off time. After work, I am not going to do anything. It's all the time you are at work basically. So if you are working from home, this is the problem there. So always try to manage your time, give time to your family, give time to yourself, and then keep on doing these things, these e-learning things developing. And I will suggest everybody to do these things, like say develop your YouTube channel with these e-learning materials, because that one, wherever you go, right, you can run those videos in the background and then start the discussion. You can tell your people that you go through those videos first and then I talk. So that becomes easier. So wherever possible, you can develop your YouTube channel with whatever material you have. And suppose say some video is not good, you feel that okay, I can develop it later. Later on, you develop and put another version, no problem, right? So whatever is ready, you put it up, right? So that the people can see and then share the ideas. This will be very nice.
Hello.
Thank you very much for this important question.
Thank you.
Hello. Hello, Dr. Ankur.
Hello, yes.
Yeah, actually, I have one doubt. We are facing a challenging task, specifically conducting the examinations. Like, yeah, your presentation was very good, giving all the suggestions how you have to go for online teaching and all. It is very good. But the main challenging task is how to evaluate the students. So it even UGC had a lot of discussions on this, and it has been the information is passed on to all the universities. Even universities also in dilemma how to cope up with the system and how to carry out the examination. So that is one of the things. Can you highlight some points on this, please?
Actually, we will be needing one more separate session on this e-assessment. I have not touched this thing right now. E-assessment, where we need to develop different rubrics for different activities, like to assess a PBL activity, to assess a seminar presentation, like a webinar presentation, to assess a short note, how to assess it, assess essay question or assess MCQs, like that. So each and everything should have a rubric or a template, criteria. Right. So how we are assessing the criteria should be there, so that there is not much of resilience among the people that okay, I wrote so much of things and I got less marks. Another fellow didn't write anything, got more marks just because he knows the teacher well. Those kind of question will come, right? So once we have a rubric, we can give them, like the students also can evaluate themselves. You see, according to the rubric, you should get this much, and you have got that. So this preparation of the rubric takes a lot of time. It needs a total workshop sort of a thing. Maybe a one-day whole workshop on rubrics we might be needing it. And the other thing is the important thing is how to run the exam from home, right? This is one important thing. Now there the only thing is we need the person to sit in front of the camera and then attempting the questions online. And they are actually mostly, you will be putting it MCQs and maybe short notes in the form of maybe 1 or 2 sentences like that. So nobody can type so much of things this thing on the online. I feel essay questions we have to do away with it and try to see something else which we can use, like a quiz or maybe match the following or some kinds of MCQs only. We have to try different kinds of MCQs. Now the problem will be how to identify the person himself is giving the exam or not, or whether it is impersonation or not. So that is the only question if he is at home, or maybe he is not looking at other study materials while he is answering the question, right? So that is like cheating. So to ensure that the person has to sit in front of the camera on, and you have to see. And now for that purpose, we don't suppose you develop your own software for that purpose. The server should be supporting so many cameras. This is the thing. So in each day you cannot have too many. Maybe 20 people at a time you can conduct the exam. that way you can hold. But 100, 150 at a time, it will be very cumbersome thing. Nobody can concentrate on 100 people at a time and see who is cheating and who is not. This will be an issue there.
I want to ask you about what about the open book exam from you, and then I want to ask from Dr. Shiba. She said that they conducted the exam in online, and how did they do that?
Yes,
And
I
then
will request
facing the problem.
Shivaji to deliver
Sure.
that. Yes.
Thank you for that question. Both Dr. Bigala and Dr. Jiva, thank you for that question. So what we do is that, as you said, we have two different types of exam. One is the open book exam, another one is the closed book exam. So if you look at even the Western universities, we have this concept of open book exams where you really do not have to worry whether the student is going to copy or not, because it's going to be a completely application-oriented question. So if you're having a completely application-oriented question, the students really have to think about the material, apply the knowledge that they have, and answer it. So that case, you really do not have to. But when it comes to the online exams, which is a closed book, we have two types that we have. The first one is, just like how Dr. Ankur was saying, we have to keep the students under the prevalence of the camera. So they need to use usually two gadgets. One would be the one where they have the phone and they have a zoom on that. So it's just like how we are talking. So we can see about 20 to 30 of them in the screen. So that's one way. And the other screen where they have the computer, they would be answering the questions. And that would be by a Moodle or a Canvas. And it can be by different modes that he was talking about, like MCQs and the rubrics. Yes, and there was a very important point Dr. Ankur touched about. It is, we have a higher working load of 4 times than our traditional method. And then when it comes to assessment, it's even higher. That was our experience that we have. And touching upon the other modes we have, for example, the OSCAR, the PBLs, those are a bit more tricky that we have. So in case of problem-based learning, what we have to do is we have come up with a rubric for a PBL, just like what we have in International Medical University or in the Western Leeds University as well. So the same rubric that we had, and we give this rubric to each one of the facilitators, and we ask them to assess each of the student according to the rubric. Examples, the first one in problem-based learning is their communication skill. The second one is how they have brought in the material or the content. And the third one is their professionalism. So all these things would be having a certain weightage. For example, 10%, 10%, and 10%. So that would be contributing to 30% of the whole of the problem-based learning. So that's one way. But the trickiest of all this is the OSCAR, which is objective, structured, clinical assessment of the student. So both in pharmacy and in medicine and in dentistry as well, we really need a coordination of 2 or 3 people. So in case of OSCAR, if you're not familiar with it, what we have here is we have about 5 to 6 stations. So each station would be having a particular question. So for example, the first station may be a patient history taking. So the student will have to go to the patient and ask for his history. The second would be calculation of the pharmacological dose, so on and so forth. So in this case, we need to have a patient, we need to have an examiner, and we also need to have a simulated patient as well. So that becomes a little bit more complicated because we need to have 3 of these people in the same Zoom. So we use Zoom, or we can also use a Skype as well. And WhatsApp is also possible. If you know, the WhatsApp can hold up to 4 people, and with the advanced version, you can have a look at 8 people in one screen. That is also possible. I think most of us use WhatsApp in India and in abroad as well. So that's also another possibility. So these are the experiences that we have so far. Thank you. And I pass the time to Dr. Ankur.
Thanks for sharing. This is a very important thing now. If you are looking for the clinical one, clinical assessment, it becomes a real headache, basically. And but I think we have to go step by step. We can go for this, what's it called, the small group micro teaching assessment there, instead of going for the like a closed book thing. Micro teaching assessment will be much easier, like small group discussions or PBLs, some kind of a thing, or seminar presentations. Through that, if you can evaluate and then it's done. Or I feel that even say earlier days we used to have the Viva host. So that can be done. That is one of the way we can assess the student. Only thing is the teacher has to spend a lot of time. Maybe 1 or 2 days will be required in session. That is one way. Only thing is how to standardize the questions. That one the panel has to decide which are the questions they are going to ask and whether the level of the questions and all. So we should have a question bank and then start asking questions like that. So this is one way we can manage it. And the open book exam is actually something like creative things, or maybe a research proposal or something, which is analytical thinking is required, right? Which is not ready answer is not there. Even a problem solving question or a clinical question can be given, which he has to find out from other places and find a solution, or discuss with other people and get a solution. So these are the things with which we can assess. Only thing, the assessment committee has to approve what are the things they are going to take into consideration to pass or fail the candidate for the next step. Any other question?
Thank you so much, Dr. Ankur. Thank you so much, Dr. Shiva David, to have joined us. Now I request our beloved principal, Dr. B. Ramesh, to please pronounce the word of thanks for us.
Thank you very much.
Sorry, hello? Hello?
Hello, yes, sir.
Dr. Ankur, congratulations for your wonderful continuous talk on 3 topics: how to cope up with the worries during pandemic, and what is the action plan for post lockdown period. And you have also touched upon the important issues in e-learning. Really, you have done a great job. Your all PowerPoint presentations were very cute and interesting. All the delegates have participated very actively. I am of the opinion that among these participants, we should hold one more panel discussion kind of thing on any of the suitable relevant topic. This is an open invitation to all the participants who have actively participated. Our Dr. Rajesh will communicate to you in the WhatsApp group what we have created. Maybe next week we will have one more panel discussion kind of thing on the emerging topic like that and all. I thank all the participants for their active participation. And once again, Dr. Ankur, wonderful really. We wish to have some more such kind of professional interaction with you in the near future also. And I request our faculty members to stay connected with you for the professional, to share your professional expertise. I really wholeheartedly thank all of you.
Thank you very much, sir,
for your wonderful briefing. Thank you so much. Thank you, one and all. Over to Rajesh.
I now request everyone to please turn on your videos so that we'll have one screenshot wherein all the videos, the photos will be collected. Everyone may please switch on your videos, the cameras please, so that we may have a screenshot. I would like to thank Dr. B. Ramesh to have given this opportunity and the platform to have had this session very fruitful. It was indeed a pleasure to have professional interaction with stars of this field. Thank you so much. Yeah.
Thank you.
Thank you so much. Thank you.
Thank you very much.
The slides will be shared to the WhatsApp group or your email IDs. The certificates will be circulated after a day. to your respective email IDs. Thank you so much. We'll be happy to have you in the future perspectives. Happy learning. Thank you so much to have seen you in. We've got G.S. Kumar here. Thank you so much, sir. Thank you so much.
Yeah.
Thank you so much.
Yeah, hello.
Yeah.
Hello, hi.
Yeah, just a last question. Just before ending the session, I would like to have a discussion.
Yes, please. Yes, please.
Yeah. Dr. Ankur, it was a wonderful presentation. So, yeah, it was a very good, nice presentation. We are able to meet after such a long time. You have given such a good talk regarding this COVID situation. One kind notice which I try to observe was Taiwan was able to make up a good situation in this particular time. They didn't have a lockdown situation also. What other measures would have been taken by India to overcome this particular situation?
Yeah, actually, the individual responsibility, that was the main issue actually among our community, because people were hiding their fever and travel history. That was the problem. That's where actually our equation didn't work out. Otherwise, whatever plans the government has done, it would have been actually beneficial, and by this time we would have got a good result. But the problem is that many people, they were not truth, and they did not volunteer for the test. And then of course there was some problem with the test kits also. They were not actually not available everywhere when we needed it. So what my thinking was there, if we had locked down the international border much earlier, it would have been much better. And then got the test kits in, and then gone for the lockdown. Without the test kits, we have gone for the lockdown. So that is one drawback here. The purpose was not actually properly met. Other countries, you see, whoever has done well is because of the improved screening. They have done massive screening and then isolated the cases, and then quarantined the people who have contacts, who have come into contact with those people. So these are the two things, like isolation and quarantine associated with the rapid screening in the community. In time of lockdown, this activity should be done.
Okay. That's it for now. Thanks for the participation. Looking forward for wonderful professional networking and happy learning. Thank you.
Thank you, sir.
Very much.
Thank you, everyone.
Thank you, organizers, for having a lovely presentation. Dr. Ankur was very inspirational, and his speech was very motivating and very informative too. Thank you, one and all. Special thanks to the Principal Dr. Ramesh and Dr. Rajesh. Thank you, sir.
Thank you.
I'll end the meeting. Thanks a lot.